If you've been following Manzer's story, you know that he's been having some complications. And one of the things that we're doing right now is the vet is stopping by to take a blood sample so we can test him for vitamin E and selenium deficiencies. When she was here last week, she took a sample to do that, but it somehow got lost in the mail. So she's coming out today and taking another sample and getting a good look over him and see how he's doing. I'm glad the vet's coming out this morning. I'm really concerned about him. I don't know what is wrong, but there's definitely something wrong. When she was here last, she was really thinking that it was some sort of soft tissue injury on his back. She also thinks he could have a vitamin E or selenium deficiency, and also the possibility of ulcers. So we've been treating him for the last week for ulcers. He's been getting sulcrafate twice a day. He's been getting UlcerGuard midday. And he's also been getting vitamin E supplement twice a day. So we're hoping that that the combination of those things really helps with the problem. He's still really tender on his back, not nearly how he was, but that's still definitely sore there. At this point, the more frequently he can see a vet, the happier I am, because I just want to make sure that I'm not missing anything. So I'm clearly not a vet, and this is my first full. So, but I feel like we've got a lot of weird stuff going on that's not very typical at all. Vet is here. Here we go. Hey, buddy.
Good baby gut gurgles. That's good. His heart still sounds good. His lungs still sound good. Temperature time. Got him up there?
Oh yeah, he's fine.
Oh, hello, sorry. Good morning.
Hey, buddy. Yeah, he's really good at all this stuff. So
yeah. I just always like to warn
yep.
in case.
Yep. Nope. Got him. We're good. Something that I noticed too, like I've been taking her out for grass and stuff. Mm-hmm. He used to be interested in grass, and he would get down and eat and stuff. Mm-hmm. Now he just stands there. He will not try. Even with hay, he won't put his head down to eat. When I hang a hay chick's net up, he'll sit and nibble on that.
He doesn't want to
Loves it.
Down.
Yep, he'll nibble on that like crazy. He will not put his head down to eat hay.
Well, we'll see if we can coax him to move his neck a little bit. You know, one of the other things that could be causing this is like low neck pain, like lower cervical pain. 100.7, very consistent. It's so hard with them when you want to like move them, like if you full size horse. I would want to pick his legs up.
And he does pick up all 4 feet.
Good. Feels funny, huh? Pushing out.
Like, where are you?
Good boy. You know, he didn't have pain when I palpated his neck last week. Good motion throughout the joints, which is good. Sometimes it's hard to tell resistance because he doesn't know what you're asking.
Yeah, exactly.
It's painful, but I'd love to see if I can wrap his neck around to at least here. Folds are very bendy, so they should be able to wrap all the way around. I think he's just confused. Good boy. Good boy. And you've seen him urinate?
I've seen him pee. I have not seen him poop.
Okay.
I sat and watched him yesterday. I had him in my round pen for several hours. I want to say probably 5 hours or longer. No baby poop. Like I saw him poop when he was 2.5 weeks old.
Okay.
That was the last time I saw him poop. And I have it on video, and that's how I know. But I remember being like, "Yay, he pooped!"
Yeah.
It was a big deal. Because that was after the full diarrhea.
Yeah.
So he had diarrhea for a week, and then as soon as I saw the first solid stool.
So I mean, either he's a secret pooper, or he's not pooping as much as he should be.
Yeah.
And if we have them not pooping as much as they should be in constipation, impaction colic is pretty common. So maybe this low grade uncomfortableness is just dryness coming through.
Right.
Last time he was a little dehydrated. I don't think he's dehydrated today, which I think is good.
Yeah. Well, when Dr. Leah checked him out June 2nd, so a month ago, because it was the same thing, I hadn't seen him poop. So she did go in and check and took some out, and it was normal.
Okay.
But and his poop looks just like hers, what came out that I saw.
Yeah.
And he pooped in the same spot she poops. So it's really hard to tell the difference.
So sensitive.
He is. Mama's very sensitive too, so it doesn't surprise me.
Family. I know it feels funny, huh? Good stretch. Good boy. Be a little. One of the other things, we didn't see anything on x-rays, which is good, but sometimes they can tweak the tendons here, and I feel like, especially right here at the highest point of his withers,
Well, and if he can't put his head down to eat, that would make a lot of sense.
Yep, he's got some, maybe the end of the nuchal ligament. Can you turn your head this way?
That way seems a little easier.
Yeah, it does.
Work on our lateral flexion, little buddy.
Yeah, it'll come in handy. You'll need to do it forever. Get there, but he's resistant to the left. But again, his scapula feels really nice on both sides. He's got good flexion and extension of both the front legs. So I think those are all good things. I think we just have this area, because right here he doesn't care, and right here he doesn't care.
Right there.
Right here. So, I mean,
It's like I'll just itch on mom. It's like I love when I'm touched.
well, I think if we want to investigate this further, ultrasound would be the next step. And sometimes that can be unrewarding because you have to push hard to get an image.
Sure.
It can be painful.
Yeah, absolutely.
So we can continue to watch and see. I'm feeling all of his ribs. I don't feel anything fractured or loose or like he's painful down any of the
How
ribs.
long does like a tendon injury take to
Usually
get better?
6. Mom in the way.
she's like
Scratch me.
Here.
It kind of depends. I know whether the length of the tendon injury healing depends on the severity of the injury, which we don't know if we can't visualize it. But usually I'd say at least 6 weeks.
Okay.
So I think it's important to keep him comfortable. If we think the Banamine for a few days did help him, we can try another short course of that and see if that helped again. And if you see a significant improvement, like him playing again and kind of acting more normal, reaching down to eat grass, I think we can consider more of a pain component, and then we can look for a longer term, because I don't want him on Banamine all the time. There are some other options we have with foals that are like meloxicam and things like that. So we can kind of go in that direction. I think it's still good to keep him on the sucralfate. And He's down. He's done with the ulcer guard, right?
Yeah, I gave him the last dose yesterday. So.
Okay.
Just kidding.
Nice. So, I think those would be good plans.
Okay.
And keep watching for poop.
So the ulcer guard, do you want me to be done with it?
Yeah.
Or do you want,
Yep.
Okay.
I think the sacralfate is going to help us more. Just coat it.
Okay.
And he's taking that okay?
Yes, easy.
Good.
He's good.
Good.
He's a lot of times he's just laying down, and I
Yeah,
just walk
just-
over and I'm like, boop, and he's
Mhm.
like, nom nom nom. Okay.
Yeah, it kind of just tastes like chalk.
Yeah. So he's gonna be, if anything, he's gonna be so good at all this random good
Medications.
care, you know. So all the general stuff.
Mm-hmm.
I was like, he's either gonna hate it because of it or that, but he gets
Yeah.
lots of scratches and stuff when he gets it. So, and he thinks that's pretty awesome.
Yeah. Boy, it's a little bit bigger than a thermometer. Oh yeah, there's normal poop right
Right
in
there.
there. Yeah. Normal little poop balls.
Cool.
That don't want to come out, but I can feel them. They're not
Okay.
super hard.
Perfect. Second blood draw. Perfect.
Such a good boy. They could all be like this. Better than a lot of adult horses.
That's the plan.
Now, is there just a vein in his neck that you know to feel for?
Yep, there's a jugular vein right there.
Oh, wow, look at that. You got lots of it too. Awesome. Wow.
Yep, there's a jugular vein that I can show you in 2 seconds.
I'm a nurse, so I'm sorry. I
Oh,
gotta ask
yeah.
questions.
Yeah. Yeah, that's a lot of blood.
Oops.
Cat fight.
Well, it kind of worked out. We just had just barely enough last time.
Mm-hmm.
So this time I was like, we'll just get
You'll just get enough.
Yeah. If we're going to be out here, we'll make sure we'll get it all.
You're so
And he didn't even like flinch.
Nope. He just kind of automatically like comes up for little snuggles now because he's so used to me kissing his nose that he's just like, oh, this is what I do. My mom's gonna kiss me. He does it to my kids too. He goes right up and puts his nose on there.
So the jugular vein runs from here to there, and
Uh-huh.
right underneath it is the carotid artery. So it's always important to make sure that you know exactly if you're going to give an IV injection in a horse. You don't want to accidentally get it in the carotid artery because that makes a lot of bad things happen.
Yeah.
Sure.
So if you have any questions, don't give injections in the vein and have your vet do it.
My mind is definitely more at ease after having the vet here. Like the vet said, you know, if he's got some sort of a tendon or soft tissue injury on his withers, that's going to take, 6 to 8 weeks to heal. And we're already a couple weeks into this, so hopefully that's all it is, and he'll be doing okay in no time. But I sure feel bad. It's so hard to see a baby not feeling good, whether it be a human baby or animal baby. And he's so darn sweet and gentle-natured that, you just feel so bad for him. He has a really hard time eating off the ground, and he just won't. So they don't have grass in their paddock, but I do take Nika out often for walks and stuff, and so they can munch on some grass, and they've got hay on the ground, and I use my hay chicks nets. So the hay chicks nets are always hanging up in their shelter. And the nice thing is he can go over and he can eat off those hay chicks nets because they're the same level. But when he tries to put his head down to eat, he just gives up because he can't. So, he can nurse just fine, and he can eat out of his little grain bucket that's hanging on the railing, but he can't eat hay off the ground. So it's one more excellent thing about our hay chicks nets is that you can hang them right at level, so if they have a back injury or something and can't put their head down, they can reach. So it's pretty awesome. Stay tuned if you want to see more updates on him. I'll make sure to keep posting about what's going on with him, and I'm sure we'll have we have that was Dr. Laura Stevens-Brown that was here today, and we have Dr. Vollrath is going to be here in a couple weeks, so it'll be nice to have her take a peek at him at that point too. I feel pretty good knowing that he's going to be checked out pretty regularly by vets, so that just makes me feel a lot better. I want to make sure that he's doing okay. So thanks so much for watching. See you in the next one. Bye.